Hello, welcome to the new episode of Dr. Kayhan Show. I am Selam Ulusoy and I am the presenter of this program. Today we are going to talk about tobacco and smoking, gastrointestinal system parasites, and again some healthy foods. Welcome, Dr. Kayhan. Yes, what do you think about tobacco and smoking?
Cigarette smoking is the largest preventable public health problem in the world. Tobacco use, both oral and smoking. The invention of a cigarette smoking making machine in the 1880s and around the turn of the century of matches that could be carried safely resulted in a marked shift in tobacco consumption from predominantly pipes, cigars, and chewing tobacco to predominantly cigarettes. The increasing of cigarette consumption was followed some 20 to 25 years later by an equally dramatic rise in deaths from lung cancer. Tobacco smoke is a complex mixture of some 4,000 individual constituents. The smoke is a combination of pyrolysis, distillation of products distributed between a particulate phase and a gas phase. TOR, the total particulate matter of the smoke once the water vapor and nicotine have been removed, is the major carcinogen of whole smoke.
What is the extra risks increasing health problems and with smoking?
The risk increases with increasing number of cigarettes, smoke per day, depth of inhalation, and duration of the smoking habit. Also, the risk also increases with the younger age at which regular smoking is begun. Increased risks for cigarette smokers: cardiovascular disease, coronary artery disease, peripheral vascular disease, aortic aneurysm, stroke, and the cancer group: lung, firstly, larynx, oral cavity, esophagus, tongue cancer, bladder, kidney, and pancreas cancer. Lung disorders: cancer, chronic bronchitis, emphysema. Complications of pregnancy: we are divided in two groups, infants and maternal complications. First one is infants, small for gestational age, higher perinatal mortality. And the second one is maternal complications, placentia previa, abrasio placentia. And the last one is gastrointestinal complications. First one is peptic ulcer and the second one is esophageal reflux. Cigarette smokers have almost twice the risk of non-smokers of developing a myocardial infarction or dying of coronary heart disease. Smokers have more atherosclerosis than non-smokers. Smoking increases the risk of hypertension. These risks decline dramatically with the cessation of cigarette smoking. By 5 years after the last cigarette, the risk in those who had smoked less than one packet per day approximates the risk in lifelong non-smokers. Lung cancer is the largest cause of death from cancer in men and women. Approximately 85% of mortality due to lung cancer is causally attributed to the cigarette smoking and is therefore potentially preventable. Cigarette smokers are 5 times more likely to develop cancer of the oral cavity and esophagus. Cigarette smoking is also a major contributing factor in cancers of the bladder, kidney, and pancreas, and an association between cigarette smoking and gastric and cervical cancers has been noted. The cigarette smoking habit is the major predictor in a population for the development of chronic obstructive pulmonary disease. The prevalence of chronic obstructive pulmonary disease and risk of death from chronic obstructive pulmonary disease increase with the number of cigarettes smoked per day and the depth of inhalation, as does the prevalence of chronic cough and sputum production, rate of decline in the measurements of expiratory airflow, and degree of anatomic emphysema. Infants of smoking mothers are small for their gestational age in weight, length, and head circumference, and they experience a higher perinatal mortality, particularly if other determinants of a high-risk pregnancy are present. Women who smoke and use oral contraceptives greatly increase their risk of cardiovascular diseases. They are over 30 times more likely to develop a myocardial infarction and about 20 times more likely to have a subarachnoid hemorrhage than their non-smoking peers who do not use oral contraceptives.
What about involuntary smoking? Do you believe this?
Yes, I believe this because there's a lot of clues about it. Involuntary smoking, environmental tobacco smoke, contains most of the toxic and carcinogenic compounds identified in mainstream smoke, and therefore the question is not whether these agents can cause disease, but rather whether the dose and mode of exposure experienced in involuntary smoking carry a measurable risk. Involuntary smoking can cause lung cancer in non-smoker. Other effects of cigarette smoking also. Cigarette smokers have a greater incidence of gastric and duodenal ulcers and delayed healing of these ulcers. Smoking also relaxes the esophageal sphincter and may contribute to the esophageal reflux. Smokers have lower blood levels of vitamin C and B12. Hematocrit and hemoglobin levels are elevated in smokers. How to stop smoking habit? How can we help? There's a lot of systems, but some of them have real proofs. First one is acupuncture. The second one is nicotine gum, hypnosis, and lifestyle changings are all effective to stop smoking.
Okay, let's talk about the second interesting subject. It is gastrointestinal system parasites. Their affects approximately 1 or 2 billion persons all over the world. Dr. Kayhan, what are your opinions about gastrointestinal system parasites?
Parasites are eukaryote. They are divided in two groups, protozoan and metazoan. First, protozoan. They include only one cell. The most popular one is amebs. Everybody knows, everybody heard amebs names. Human amoebiasis is due to infection with the enteric protozoan Entamoeba histolytica. This parasite infects 10% of the world's population. Infection results from ingestion of the fecally excreted acid-resistant cyst form. Exkistation occurs in the small bowel, leading to the colonization of the colon with Entamoeba histolytica trophozoites. Transmission of infection results from fecal contamination of water or food, or direct fecal-oral contact because of poor hygiene or anal-oral sexual practices. Clinical symptoms associated with Entamoeba histolytica infection we divided in two groups. First one, intestinal disease. The second one, extraintestinal diseases. Intestinal diseases, this is more wide all over the world. Asymptomatic infection, symptomatic non-invasive infection, acute rectocolitis, we call it dysentery, fulminant colitis with perforation, toxic megacolon, chronic non-dysentery colitis, amoeboма, and the second one is liver abscess, complex with peritonitis, emphysema, and pericarditis, lung abscess, brain abscess, and genitourinary diseases. Infected patients present with non-specific gastrointestinal complaints such as bloating and cramps. Amoebic rectocolitis is characterized by the subacute onset of bloody diarrhea, abdominal tenderness, weight loss, and fever. How can we prevent from these amoebic illnesses? Enterohistolytic infection can be presented by the availability of clean water, adequate sanitation, and avoidance of sexual practices or living conditions that facilitate direct fecal-oral contamination. Boiling is the only reliable way of killing cysts. In endemic areas, uncooked foods such as salads, vegetables should be avoided. Treatment is also antibiotics. The second one is Acanthamoeba castellani and Nagliori fowleri. These are also friends of amebs. Both of them are the reason of amoebic meningoencephalitis, especially in immunocompromised persons we call them AIDS patients. And the third one is balantidiasis. The main reason is Balantidium coli is a large, motile, oval ciliate, some 5 to 10 times the size of erythrocyte. Infrequently, a cause of disease, the protozoan can penetrate the colon mucosa with the formation of deep ulcers. Illness consists of dysentery, usually bloody then with resulting dehydration and protrusion. Complications include colonic perforation at the side of the ulcers. The second one is giardiasis. Giardiasis is an infection of the small intestine caused by the flagellated protozoan Giardia lamblia. When symptomatic, it results in diarrhea, malabsorption, and weight loss. It has two forms, cyst and trophozoite. It spreads by two routes: waterborne infections, particularly in contaminated community water supplies, and direct person-to-person transmission. Epidemics in daycare centers for children and among promiscuous male homosexuals indicate that direct person-to-person spread can occur. It is likely that both beaver and dogs carry Giardia species infections for humans. Giardia is frequently asymptomatic. Diagnosis is established by demonstration of cysts or trophozoites in stools or of trophozoites in small bowel contents. Treatments: antibiotics. Metazoans, they have more cells. First one is helminths. The most popular group is nematodes. Ascaris lumbricoides, intestinal nematode, roundworm disease in the lumen of jejunum and in the mid-ileum. This is the part of intestines. Infection occurs by the oral route when soil containing embrupted eggs is ingested. Ascariasis affects approximately 1/4 of world's population and is likely the most prevalent helminthiasis of humans. Infection is common in Africa. Symptomatic cases can be divided into two broad categories based on the phase of infection and the site of pathology: pulmonary or gastrointestinal tract. Pulmonary disease is caused by the migration of larvae in the small vessels of the lung and their subsequent rupture into alveoli. Tissue damage is thought to be due to the host immune response, which includes production of immunoglobulin E and eosinophilic. Transient pulmonary infiltrates, fever, cough, dyspnea, and eosinophilia lasting 1 to several weeks are the major clinical manifestations. This complex of symptoms and signs is frequently seasonal and coincidental with environmental changes that favor development of infective stage larvae in eggs, spring rains that follow cold and dry periods. Intestinal obstruction can be occur. The onset is sudden and characterized by colicky abdominal pain and vomiting. It infects biliary and pancreatic duct. A malabsorption syndrome characterized by stertoré and low vitamin A levels has been reported. The second one is hookworm disease. This is the group of nematode also. The major hookworms that infect humans are Ancylostoma duodenale and Necator americanus. Infection occurs when exposed skin maintains contact for several minutes with soil contaminated with parasite eggs containing viable larvae. Adult hookworms have a lifespan of 2 to 5 years. Hookworms infect over 1 billion persons worldwide. The highest prevalences of infection occur in tropical and less developed countries. Hookworm disease is due primarily to gastrointestinal blood loss and attendant iron deficiency anemia. Pruritus at the side of the larval skin. Penetration occurs occasionally. Hookworm infection is diagnosed by identification of the characteristic round eggs containing convoluted larvae. The third nematode is Strongyloides. Strongyloides stercoralis infection is endemic in warm climates worldwide. In immunologically normal individuals, infection is usually asymptomatic or causes gastrointestinal dysfunction, manifest as abdominal pain, bloating, or bleeding. Strongyloides infection occurs when skin contacts free-living filariform larvae in the soil. After penetrating the skin, the parasites embolize to the small vessels of the lungs via the venous circulation. It's endemic in Africa. It's especially common in overcrowded situations in which sanitation and personal hygiene are poor, such as in institutions for retarded children and camps for prisoners of war. Groups at risk include persons who are chronically taking corticosteroids, renal transplant recipients, patients with Hodgkin disease and other lymphomas, and leukemic and AIDS patients. Dermatologic manifestations include self-limited creeping eruption. The lesion migrate approximately 10 cm per hour. The larva elicit serpiginous erythematous papules and occasionally urticaria around the buttocks, upper thigh, and lower abdomen. Gastrointestinal disease usually manifests as abdominal bloating, vagoepigastric pain, and diarrhea with nausea. Symptoms are exacerbated by eating. Hematochezia and melena occur in 20% of patients. Prevention. Infection is preventable by avoiding skin contact with contaminated soil. Immune-compromised patients in endemic areas should be advised to avoid walking barefoot. It's suggested by some authorities that prophylactic thiobendazole 25 mg per kilogram 2 days period. Enterobiosis vermicularis are pinform infection is cosmopolitan in its distributor. It spreads rapidly in conditions in which person to person infection occurs by the fecal oral route. Embryonated eggs carried on the fingernails, bed clothing, or bedding are ingested and hatch in the upper small intestine. Adult parasites measuring 2 to 5 mm in length. Female worms migrate nightly out of the rectum and deposit large numbers of ova in the perianal and perineal areas. Enterobius vermicularis is a rare cause of appendicitis also. It makes vulvovaginitis, urethritis, or peritonitis. Diagnosed with eyes to see is over. Treatment single dose mebendazole 100 mg one time. Personal cleanliness is recommended. The second one is dracunculiasis, infection with the parasite. Dracunculiasis medicines. Diagnosis of patent infections is easy. The thin adult female worms, each up to 1 meter long, emerge directly through the skin, usually at the lower leg, ankle, or foot. The worms emerge 10 to 14 months after victims have drank water containing infected cyclops. Swelling, local arteries, and are main symptoms. Since the most effective intervention against this infection is to provide safe drinking water.
Okay, now the advertisement time. In the last program, we have started to talk about the healthy foods. Now we are continuing this subject. Today, our foods are soursop fruit, star apple, and tamarind. Yes, Dr. Kayhan. Start with the soursop.
Soursop, also known as graviola, is an evergreen fruit that is rich in several compounds. It contains beneficial antioxidants and minerals such as calcium, phosphorus, and a small amount of iron that add values to human health. The contribution of soursop fruit to human health are not limited to cancer treatment, energy boosting, and bone health maintenance. Below are some of the health benefits of soursop. One is helps in cancer treatment. 2, normalizes blood pressure. The third one is has anti-inflammatory properties. This is important. Soursop fruits are rich in anti-inflammatory properties and antioxidants that help to suppress the oxidative damages and promotes gastric health, and is also said to contain anti-ulcer properties. Many studies which have been conducted on the anti-inflammatory properties of this fruit have yielded positive results, as it has a great impact of bites and injuries, which could lead to inflammation, swelling. In this case, it is not just the fruits that can help alleviate inflammation, but also soursop leaves as well as the roots, juice, and bark. Due to this effect, it can be used to reduce pains and swelling caused by arthritis, rheumatism, bites, and other, as well as function as an analgesic. The fourth good effect is induces better sleep. Tryptophan present in soursop functions as aromatherapy that the body needs to make niacin and serotonin in order to produce better sleep. The fifth, relaxes of the muscles. Certain substances that are present in soursop help to make the muscle and the whole body feel relaxed after eating it. Its anti-inflammatory properties also help in this case, as it helps in reducing swelling in the muscles and joints and relieving the body against such in any way. The nutrients can be found in both the leaves and fruits. The sixth, lowers harmful cholesterol. Soursop fruit contains monosaturated fats that help in lowering the level of harmful cholesterol in the body and moderate blood pressure. It helps in balancing out high fats which we might have accumulated from his high fats diets. It helps in reducing the cholesterol level in the body, the bad cholesterol or low density lipoprotein. The leaves of the soursop plants are said to have hypocholesterolemic properties, which helps in the effective reduction of bad cholesterol in the body and as such can prevent heart problems and others. 7. Helps treat fever. In some parts of the world, such as India and the most part of Africa, soursop has been locally used in the treatment of ill health conditions like fever and related conditions like hotness of the body, diarrhea, malaria, dysentery, and seizures. The leaves and the bark is most effective in this kind of treatment. Most times it's boiled in order to bring out of the vital nutrients in the substances and taken orally accordingly. This has proved effective in the treatment of fever and other associated symptoms and is widely practiced in mentioned places for the effective treatment of such conditions. The 8th one is improve the skin. Additionally, the seeds of soursop can be reduced to fine particles and used as skin astringents to treat body wrinkles and aging lines on the body. This application of this substance to the skin can help in reducing skin-related problems like skin papilloma, as well prevent you from getting them. Improves vision. Soursop contains lots of vitamins such as vitamin C, vitamin E, and A, which occurs in the form of beta-carotene. The vitamins act as antioxidant in the body as they help reducing the risk of associated to the eye. They help in minimizing the oxidation effects, stress in the body which could result in inflammation and other health conditions, thereby preventing the chance of getting cataracts and other eye problems such as macular degeneration. Also, soursop helps in infection treatment. It has been tested and proved that soursop can help in the treatment of infections in the body, such as those which are caused by a parasite, bacteria, and fungi. Parasite-induced infections such as leishmaniasis, which can be gotten from sand fleas bite, is one of the infections which soursop has shown a positive impact on. All parts of the tree has proved to be effective in the treatment many health conditions. In this case, the leaves of the soursop tree is effective also in the treatment of infection, which most times is easily squeezed to bring out of the liquid extract of the leaves, which is medicinal and can be taken either orally or applied to the skin infected area. Soursop reduces blood sugar levels also. Diabetic patients avoid lots of foods and fruits which ordinarily would have provided them with enough nutrition, but maybe due to their abilities to increase the blood sugar level, they exclude them from their dietary plans. Unfortunately, soursop is one of the fruits which helps in reducing the blood sugar level and is highly recommended for diabetic patients and as well good for everyone as it will help minimize the chance of having high blood sugar level. This research and more have proved that soursop is a good anti-diabetic agent. Soursop helps in weight loss. Soursop is one of the fruits which can help you reduce the weight fast. It has been researched to help in weight loss as the experiment on rats was proven effect. Soursop fruit can help in this case, but the leaves are more effective when it comes to losing weight and is used to making of most green tea. Soursop contains lots of nutritional contents like fruits, fructose, fat, protein, vitamins A and vitamin B like thiamine, riboflavin, niacin, and more. Soursop is a tropically fruity which has a thick, prickly flesh with sweet, sour taste. The fruit is native for Caribbeans and Americans, though it's now widely grown in many countries of the world from Asia to Africa. How to consume Soursop. Soursop can be eaten in different ways according to one's choice, but most commonly it is eaten in its raw form due to its flavor and savory taste. It can be used as a smoothie and added to one. It can also be used in the making of soursop, milkshakes, ice creams, in beverages, and as juice. Medicinal use of soursop. In many parts of Africa and India, traditional medicine practitioners use soursop fruit in treating some sicknesses, such as parasitic infection, hypertension, fever, and others. Downside of soursop. Soursop fruits, its leaves, roots are termed to the benefits except for the seed and bark in few cases, which is advised not be ingested as it can be lead to promote Parkinson's disease, which results in muscle stiffness and in most cases comes from involuntary movements. This is a result of the content of anonacin, which is one of the neurotoxins found in soursop. The bark of soursop, irrespective of its ability to elevate many elements, still can lead to other health conditions, such as due to its content of hydrocyanic acid and even myrcene, which can cause the inflammation of the eye and can lead to cancer in worst cases. As a result, these are phytonutrients present in soursop that contain antioxidants that contribute to the overall enhancement of human health. In addition, decoction of soursop leaves is used to control feverish symptoms and convulsive seizures. All parts of soursop, including the leaves, fruits, and extracts, are favorable to health. The second one is star apple. African star apple is one of the native fruits which are indigenous to tropical African countries like Nigeria and contains lots of nutrients which are numerous and beneficial to health. Africa's star apple is used to treating high blood pressure, diarrhea, digestive issues and fever, and lots more. Its benefits are, first one, aids in digestive health. The active fiber content, which is mainly a carbohydrate in star apples, helps to keep the digestive system healthy as well as helps to overcome constipation and other digestive problems. It helps in normalizing your bowel movements and aids to get rid of constipation as well as other problems of the digestive system. Consumption of star apple helps in preventing the most dangerous health problem like cancer of the colon. The second one is natural antioxidants. African star apple serves as a natural source of antioxidants, which helps to remove damaging oxidizing agents in the body system and keep the immune system healthy. Free radicals like heart attack and cancer can be prevented with antioxidant-rich foods like star apple. Regular and moderate eating of star apple can help in reducing the development of dead cells by removing free radicals. The third one is boosts immune system. These vitamins that are present in star apples help to produce collagen that promotes immune health and moderates sugar levels in diabetic patients. Africa's star apple consumption helps in boosting immunity due to the presence of vitamin C and carotene in it. The fourth one is prevents anemia. It has a content of iron that is necessary for the body to produce hemoglobin and prevent iron deficiency anemia. Iron deficiency is a type of anemia that occurs because of insufficient of iron in the body and can lead to dizziness, loss of appetite, weakness, rapid heartbeat, headache, shortness of breath, and fatigue. All these can be prevented by consuming foods with high iron content, such as African star apples and vegetables. The fifth one is strengthens bones. Important minerals such as calcium and phosphorus that are important for maintaining strong bones and teeth are contained in African star apples. Sixth one, it helps in weight loss. Proper consumption of African star apples helps in managing weight loss and maintaining complete body health and beauty. African star apple is one of the best fruits for weight loss due to its low fat, and also it contains a high amount of dietary fiber that improves satiety, making you feel more satisfied even after a long time. It's an excellent fruit to take when you are trying to lose weight. The eighth one, good source of vitamin C. Vitamin C is known to be a water-soluble nutrition, which is important to assist several essential functions in the human body. Also, it's an antioxidant, and it controls the production of collagen, protection of heart, healing wounds, enhancing vision, improving immune health, and decreased blood sugar levels. Since the human body cannot produce vitamin C itself, we can easily get it from outside of the consuming African star apple because it's one of those foods with high content of vitamin C. It prevents diabetes. Another essential benefit of African star apple is that it aids in controlling sugar levels in the blood, and this is the best food for people suffering from diabetes. Star apple fiber aids in keeping the blood sugar level under control. Its rich in antioxidants helps in protecting the body against health problems such as cancer, diabetes, and heart problems. It has low calories. African star apple is known for its low calories. One portion of this fruit contains 67 calories, making it good for those trying to lose weight. It can be used as a medicinal drug. The leaves, seeds, and the fruits are good herbal medicine for treating of various health issues. Cooking of the leaves or bark can be used in treating diarrhea and dysentery. The shell of star apple tree aids in treating yellow fever and malaria. African star apple leaves are used in treating skin rash, stomach pain, diarrhea, and stomach pain also. The seeds of star apple are also used in preparing ointments for treating skin infections and virginalis. It's good for pregnant women. African star apple has an acidic taste, is mostly liked by women during pregnancy because it helps in preventing the urge to vomit. Star apple helps a lot in some problems faced by women during pregnancy, like treating sore throat, constipation, and indigestion. Therefore, it's advisable you consume this fruit during pregnancy because it will be a great help. African star apple grows only in subtropical or tropical climate. It can be cultivated easily from seeds and will take 10 years for the young seedling to mature and bear fruits. That's why grafted trees from air layer cuttings or local nursery are better, as they bear fruits from 1 to 2 years after cultivating in the ground. Its botanical name is Chrysophyllum cyanota, and it is usually available from December to April. As a result, in conclusion, generally African star apples are quite nutritious, and the leaves exhibit some palliative properties that have some proven as remedies to certain ill health conditions such as skin rashes, diarrhea, and stomach pain. It serves as a source of important daily vitamins recommended for health, which are vitamins A and vitamin C, which support many important functions of the human body. Regular consumption of this fruit, star apple, will definitely boost your health in many ways. The last beneficial foods, healthy foods in this program is tamarind. Black velvet tamarind is an indigenous fruit, also known as African velvet tamarind. It's without any adverse reaction and is being eaten by all ages because it's a kind of vitamin C supplement. The fruit inside in the shell is either dried or pulpy with taste sweet sour. It's packed with lots of nutrition that helps to promote health and manage some health conditions. First one is improve water acid balance. Black velvet tamarind. has potassium content, which helps to regulate water balance and acid-base balance in the blood tissues. Because of its potassium power, it is more effective in diarrhea illnesses. The second one reduces inflammation. The vitamin C content in black walnut tamarinds help to fight against microbial infection and reduce inflammation in the bronchial tube, which in turn prevent cancer, which is one of its underlying causes is inflammation. Research has shown that patients with bronchitis can be treated with black walnut tamarinds, as it will supply them with enough vitamin C to reduce the inflammation of bronchial tube linings. Third effect is lactation. The pulp of black walnut tamarinds is said to contain nutrients that are necessary for milk secretion, which implies that it improves lactation. This makes it good for pregnant women and breastfeeding mothers, as it will help increase the breast milk secretion. It's widely believed it does so, though there has not been any medical proof about it. Locally, in some parts of Nigeria and other African countries where it's coming, it's also used in the treatment of infections, especially the ones that affect the genitals. The fourth, it improves red blood cell production. It contains a good number of minerals, such as iron, which is necessary for the production of red blood cells, with some other minerals such as copper, helps in strengthening the blood vessels, and in most cases, it works together with iron to help in the formation of the red blood cells, and also works to make sure that iron is absorbed and needed by the blood. The deficiency of copper in the blood is called hypocopremia. Calcium is most commonly known to help in the blood and teeth formation, but it's more than that. Calcium, such as the one of the present in black walnut tamarinds, helps in blood clotting and as in other necessary functions of the body. Zinc is commonly found throughout the cells in the body, specialty the platelets, and has a lot of functions. As regards to blood cells, zinc mineral helps in the clotting of blood. Therefore, if there is a deficiency of this mineral in the body, it can cause unexpected clotting of blood. The amount of iron present in the fruit is good enough for blood protection and anemia prevention. It reduces body pains. Presence of some volatile phytochemical compounds with different medicinal values in black walnut tamarinds, such as methyl salicylate, pyrazine, alkyl triazole limonen, geraniol, safrole cinnamic acid, made it a solution for body pains and certain illnesses. Most of the above-mentioned compounds are used in cosmetics and other products which are used as sport massage creams. They are suitable for bruises, sprain, back and body pain, arthritis, and much more. Therefore, the intake of these fruits will help in the supplying the body with natural pain relievers and help alleviate some health conditions that induce pain. It prevents micronutrition deficiency. Some nutrition elements, such as the vitamins and minerals contained in the fruit, act as micronutrients that help to protect the body from micronutrition deficiency. Micronutrients are needed by the body in small proportion, and they are very vital for the function of the cells and organs in the body. Therefore, black walnut tamarinds contain lots of micronutrients like iron, vitamin A. It acts as an antioxidant. It contains tartaric acid, which is a strong antioxidant that protects that body from free radicals, which cause damage to the body's vital organs and cells. It also regarded as alpha hydroxyl acid, which can also help in exfoliating the skin, removing dead cells from the skin pore. It promotes digestive health. The pulp of black velvet tamarind also contains non-starch polysaccharides, which help to maintain a healthy digestive system and reduce blood cholesterol. It's not digested in the body, small intestine, and therefore provide the body with no calories, which are also good for weight loss, but helps in making sure that digestive system in function well. It treats dry eye. Potassium contained in black velvet tamarind is one of the reasons it's suitable in curing dry eyes. Potassium helps in making the eye moist at all times, and its deficiency leads to dry eyes, which comes with itching, twitching, and other symptoms. Black velvet tamarind is a seasonal fruit and is native to Africa, especially those in the tropical areas like West Africa countries, and has the scientific name Dialium indium or wild Dialium guineense. It's most times regarded as Nigeria velvet tamarind or African velvet tamarind, and is known locally in Igbo as Icheku, in Yoruba as Ewan, and Hausa as Tsamiya Kurum. It's called Likli Liki by some people. It's also grown in other African countries such as Senegal and Ghana, where it is known as Yoyi, and its cultivation has extended to other tropical Asian countries as Malaysia, Indonesia, and Thailand. Though it's not scientifically proven, but locally black velvet tamarind has been used in the treatment of many ill health conditions, which is said to have proven effective, which include the root, leaves, and bark of the black velvet tamarind tree. It is used in the treatment of malaria, diabetes, as it reduces blood sugar, and it's used as a pain reliever, treat bronchitis, and much more. In the conclusion, black velvet tamarind is not as common as other fruits like oranges, bananas, apple, etc., because it's a seasonal fruit, and even most times it's neglected by many people, but it contains many vitamins that many of popular fruits comes from with other health benefits.
Thank you, Dr. Kayhan. This is the end of our program. See you next episode. Bye-bye.